Good evening, Los Angeles. From the beginning of this crisis, I've made you one promise, which is to tell it like it is. And let me tell you tonight, we are still, and very much so, in an emergency. I know it's tough to feel that as the days go on, and we become numbed to the numbers. We think that life somehow has returned in small ways when it is fundamentally still different. We're exhausted. We want to give up. There are days we don't know what will happen in the days ahead. But I want to remind us of how strong this city has shown itself to be in the toughest of moments, how we've been able to turn things, to collectively and generously, and from a place of love and resolve, take the tough decisions, make the tough moves, and I need you to do those things again. Not for me, certainly not for our city government, but for yourselves. For everything and everyone that you love, your families and your workplaces and your communities. I don't need to tell Angelenos that we can't wish this virus away. We have to work it away, and I know it's really hard work. We need to work it away by wearing masks. We need to work it away by washing our hands. We need to work it away by keeping our distance. And we need to work it away by, yes, staying at home right now, whenever possible. We saw the impact, the success of doing that in the past, and we need to continue to see it right now. Why? Because lives are at stake. We've already lost too many. We know each day we lose more. And we want to do everything we can to make that number as small as possible. We made so much progress in March and April and May, but there's no question that the pandemic has gotten worse here in LA, across California, and across this country. We can't ignore those facts, and we certainly can point to bright points. We can show that we haven't been as devastated as many other big cities have been with loss of life. We can say that our infection rate has definitely been higher, and that right now our infection rate isn't skyrocketing like we see in other cities where the positivity rate of tests is as high as 25 and 38%. But we also aren't in a place where we can let up or pretend that this disease isn't affecting people, hospitalizing them, killing them each and every day around us. We have to return to the point where we are back in control of COVID-19 instead of COVID-19 being in control of us. It's that simple. Let me tell you the bad news. We have never had as many people infected or infectious. We have never had as many recorded positive cases each day. And we've never had as many people in the hospital as there are tonight as I speak to you in Los Angeles. I know it felt like we were maybe over half of the way there. I know we felt like we somehow had eradicated the danger of COVID-19, but every night I spoke to you, I said it's just as dangerous today as it was on day one. And it is a reminder to each one of us that that strength that I saw and that I still do see that we brought in March and April and May, that energy to be able to say we will rise up against this, we need to bring it back at a moment when this threat is higher than it's been before. People are dying. And we also know that this disease has taught us lessons about how to be smart and moving forward and yes, sometimes moving backwards, but without whipsawing to nothing or to everything, being open or closed. Too many livelihoods rely on us. Too much of our future prosperity relies on us and the actions that we take here today. The only way to open the economy is to do it gradually and then to see where numbers are. And if the numbers are in the wrong direction, is to step back, to assess, to wait, to bring those numbers back down before we take steps forward again. So it's time to temporarily close our gyms, our fitness centers, places of worship, our malls, our hair salon and barber shops, as well as personal care services such as nail salons and tattoo parlors and massage therapy locations. These closures are important, and I take no joy in announcing them. But I support what our governor and our county has moved forward with today. And in the city of Los Angeles, we will update our Safer at Home order here, the Safer LA order that has told us all that we are safer when we are staying away from each other, when we're not letting up, and when we're practicing all of the things that we know now will protect us and our families. We did the right thing before, and now we have to do the right thing again. I know how tough this will be and is on business owners, on employees, and the general public who love being out in Los Angeles. It's an incredible city. But if you remember in the first days of addressing you all, I talked about how in history, in the pandemic in 1918, that LA had made the right decisions, had moved forward in the right ways. When other cities had gotten rid of wearing masks or opened too early, that their recovery lagged for years longer than here in Los Angeles. I want us to repeat that history, to do the right things in the short and medium term so the long-term prosperity of our city remains resilient and strong. Later this week, we will talk about mitigating, even when we take these steps backwards, those who are most affected. I'll talk to you in a second about our rent assistance program, which went live today for applications. But later this week, we'll talk about businesses, particularly restaurants and personal care establishments who will need that help right now, and everything that we can do to bring them the assistance to keep their businesses from going under for good. And I know this crisis has hit our renters and our landlords especially hard. And today, the city launched the largest rent assistance program in the nation from any city at $103 million. And again, as always, I want to thank my partners in this, our city council, led by our council president, Nuri Martinez, and other council members who started these programs early on. And together, we've taken our CARES money to allow up to $2,000 per renter directly paid to landlords so they too are helped to move forward. Today, it opened up applications at 8 a.m. Don't worry, again, there was high volume at the beginning. Our tripwires worked the way they were supposed to. We went and made sure they were back up and running. By the end of the day, we had, I think, over 150,000 applications. We had a high volume, but remember, this is not first come, first serve. This is open until midnight, Friday night. So there are 5 days to make sure that whether you do it online or on phone, that you can apply and make sure you're in the mix at hcidla.lacity.org or calling 844-944-1868 between 8 a.m. and 10 p.m. The action that the governor took today is the right approach. And I thank him for making sure that we did it across the county and across counties in our region. It's exceptionally difficult if one place next to another one doesn't have the same regulations, because we see the spread when people can go across the street or over a city or county boundary to engage in risky activities. We need to continue to work regionally, and we need to work across the state and nation to contain the spread of this virus. These changes are in effect right now in the city of Los Angeles and are designed to stop the indoor gathering of people, which is how this virus spreads. The governor is also closing offices for non-essential sectors. Our city of Los Angeles orders have always stayed there and always required telework. We've never fully reopened offices, but these restrictions now will go further. In the first months of this crisis, we had city workers who visited businesses to make sure that they were aware of these protocols and public health orders, and they were respecting all the aspects of them. With these new closures, we will now increase our visits to more businesses, follow up on even more complaints in person in the days and weeks ahead, and as I've always said, to first, educate, second, encourage, and lastly, enforce. But today, the county's Director of Public Health, Dr. Ferrer, said, quote, "Right now, everything is pointing towards an alarming trend." So while the city of Los Angeles' COVID-19 threat level remains at orange, we are on the border of going to red. It is up to all of us to make sure that we don't. Outdoor activities are, as we've learned in this, considered safer, including outdoor dining, which remains open. But if you do an outdoor activity, please do it either by yourself or with other members of your household. Please don't get together with others that you do not live with. And as a parent, I know how important it is for our children to go back to school. They are our future. We don't want them falling behind, and it's about their development first and foremost. It's also about parents who need to know that their children are someplace safe if they're returning to work. But today, the Los Angeles Unified School District announced that the fall semester will begin where the last one let off, with distance learning. That students will not attend classes in person. I support this decision because we must prevent gatherings and should only open when it is safe for our students, our staff, our teachers, and our families. And I hope the work that we do will bring that day forward more quickly. But I know this decision impacts families, creates challenges for caregivers, and I want you to know that our team is committed to working with LAUSD and communities and nonprofit partners to ensure our most vulnerable children are not disproportionately affected by this action. These changes today reflect the reality of this moment. We've done this before and recognized it before, and we've taken the right steps before. Cases continue to climb. They now average over 2,500 cases each day. Today was 2,593 new infections that were diagnosed positive in the county of Los Angeles, bringing the total to 136,129. If we were an independent country, Los Angeles County would have the 20th most cases in the world. Put differently, we have more cases in Los Angeles County than all of Canada. 964 of these cases were in the city of Los Angeles. For comparison, when we flattened the curve in late April and May, the county was averaging, 875 cases. We are now nearly 3 times above that today. Our death numbers are always sobering and absolutely sad, but they remain steady, and today the county reported 13 deaths, bringing the total number to 3,822. But it's important to remember that our deaths will trail the cases that we're seeing. I'd also want to remind young people and speak to them specifically today that since this pandemic began, Los Angeles County has seen 56,888 cases among 18 to 40-year-olds. It's now 50% of new cases. It's the highest number of infections among any age group. And this Saturday, 3 Angelenos aged 18 to 40 died. This disease can kill anyone, and certainly infect anyone. If young people contract COVID-19 at these rates, they'll bring it back to even more vulnerable members of their family with pre-existing health conditions or who are over 65. We've shown the work of bringing down deaths among some of our most vulnerable. Now, outside of our senior nursing facilities in LA County, African American deaths are lower than the population of African Americans because we've surged the testing, we've publicized the importance of them, and done work with community partners to make sure that this disease doesn't disproportionately kill Black Angelenos. But we're seeing soaring numbers in the Latino community outside of our senior nursing facilities. But the good news is inside our senior nursing facilities since May, we've reduced by over 80% the number of our seniors who are dying by getting in there with the tests, by surging teams in there, and it's that same smart response to this COVID-19 crisis that we will use moving forward. I'll get to that in just a moment, but let me walk through hospitalizations. Today, as I mentioned, we've never had more people in the hospital because of COVID-19, 2,103 Angelenos. And across the county, there are now 766 available beds, 625 of which are acute care, and 141 ICU beds. We have a strong ventilator capacity at 1,128. But I want to put in perspective that a month ago we had under 400 ICU patients, 397. Today there are 565 ICU patients who are severely sick. This is a 41% increase since last month. And to families with a loved one who is hanging on, our thoughts, our prayers, our healing energy is with you every single day. We've faced daunting data like this before. Don't let it overwhelm you. Feel the power that you have to do something about it. We've taken control of COVID-19 and we can do it again. So please do those small things that make a big difference. If you think you've been exposed, ask your doctor for a test or get tested at a local CVS, a community health center, or a city, county, or state site. There's a test for you. And city sites this week, we are offering more than 100,000 tests. They're booked for tomorrow, but tonight, there are tests that will go online for Wednesday. This is a 25% increase in testing capacity from just last week. And our mobile testing teams that I just mentioned a second ago, they've been deployed, most recently to South LA, around the LA apparel factory that many of you have followed in the media, where over 300 cases have been diagnosed and 4 deaths resulted. Because LA Apparel Factory was shut down that day, we tested in the surrounding community where there's other factories and for everyday folks without an appointment. More than 1,100 community members got tests in those 2 days. We know that it's sometimes not easy to make an appointment or to drive to a testing center, so we're going to continue bringing those mobile testing teams to communities around the city, from our public housing developments, which we're in every single day until we finish all of them. We'll be headed to Nickerson Gardens later this week, as well as what we're doing on the street for people experiencing homelessness, working with our clinics and surging continuous. We've done now a second round in our our skilled nursing facilities, which, as I mentioned before, have helped us reduce those deaths by 80%. As a reminder, tests are prioritized. First for people who have symptoms or think they've been exposed, for essential workers who work in a high-risk environment. But over 20%, I think it's actually closer to 30%, of the cases we've caught have been among asymptomatic people without symptoms, which is why we keep offering tests for both those who have had symptoms and those who don't, but may have been exposed. But please don't abuse these tests. These aren't an excuse to go and do things which are not permitted under our orders. To find any of the 100 testing locations that I mentioned, or one of the city, state, or county sites, please go to coronavirus.lacity.org/testing, or just call 311 if you live in the city of LA. And please, be honest with yourself. If you've been gathering with people outside your household, and maybe because you know them, you let your guard down, because they're familiar, they're a friend, but they don't live with you, you need to stop doing that right now. It's selfish, but it's also dangerous. It's part of the reason we're stepping backwards today. So please, do the right thing as we did in those first few months. Do not host a party, do not attend a gathering, don't treat this like a normal summer break. This virus is not taking the summer off, and we can't afford to either. Los Angeles, I know this is hard. I know you're drained. We all are. But we're also stronger than we think. We think back in past generations that have overcome excruciating moments: slavery, world wars, depression. The things this country has risen up year after year, struggles that have lasted lifetimes, make this moment pale in comparison. We can get through this. We can make these small sacrifices. We can wear a mask. We can clean our hands. We can keep 6 feet between us. And in doing so, we can accelerate the day forward in which we are back at school and our economy is roaring back and we are rebuilding our prosperity and enjoying our city. I know we just want a vaccine to arrive or a magical medicine to be here tomorrow, or to just have our normal lives back. But I know too that people are working hard to push through this. I began my day in Pacoima with volunteers and members of the Sikh community at the Gurdwara that is there in Pacoima, with the Khalsa Care Foundation, our Department of Disability, our CERT volunteers, and so many others, the Red Cross as well. This location has helped provide some of the 100,000 meals that have been provided to Angelenos living with disabilities who would go hungry during this crisis were it not for this generosity. It was an incredible sight, from our seniors who were cutting onions at one table, to our young people who were assembling many of these meals, to the bus drivers who were taking them, to the zoo where city workers were helping distribute these. This was, to me, an expression of the very best of Los Angeles, of who we are in tough times. This weekend, I was with Assemblymember Miguel Santiago and the group Urban Partners LA in Westlake, where we are distributing food and masks and census information with an amazing group of volunteers led by Tammy Tran, neighborhood council leaders like Steve Bay from the Wilshire Koreatown Neighborhood Council, and labor leaders like Nam Lee from the United Food and Commercial Workers Union, representing all those frontline workers who have been at the grocery stores and retail establishments like pharmacies since day one. I still see the spirit of LA around us, but more importantly, I feel your strength, Angelenos. You are resilient, you are tough, and you will not let down your guard. And this city government will not stop working for you. On tough days like today, where it might feel a little more hopeless, reinvest and double down in hope by helping each other, whether it's by the small act of staying home or whether it's by volunteering and helping another Angeleno. I have no doubt that we will get through this together. We will get through this together. But we each need to do our part, and we cannot let up. So please be part of the solution and stay safe and stay healthy and stay at home. Wishing all of you peace and love in our continuing fight for justice. Thank you. And with that, I'd be happy to answer questions. I'll take the first question. Thank you.
First question will be from the line of Claudia Pisciuta with KNX News Radio. Please go ahead.
Hey, Claudia.
Hi there. I have a couple of questions.
Sure.
So I'm wondering if you can tell me what the latest projections are on people in the county believed to have the virus and who may be unknowingly infecting others. I've been trying to get that from county officials all day, and they have yet to get back to me on that. Also, earlier in the pandemic, you were warning that we were just days behind New York at its worst. And now, while the transmission rate is lower, there are a lot more people who are infected, meaning we could still see a big surge even with a lower transmission rate. So why aren't we at threat level red? My last question. While the city is going, what is the city going to do to make sure that the latest restrictions are implemented? What will be done to enforce them? Thank you.
Okay, let me try to hit all three of those. Those projections I don't have. They usually come out, I think, tomorrow. So keep asking them, and we'll ask them as well. I do know that we brought down from 1.26 the R0, or the infection rate in terms of how many people the average person reinfects. We brought that down to 1.01, it was estimated, and that may be somewhere in between those two now, maybe about 1.14. But I don't have any further numbers. Those projections usually come out to us as well privately tomorrow. In terms of why not red, we're right there. I mean, we do have mixed bag, right? A mixed bag of more ventilators. We still have some strength in our hospitals, but we also have more hospitalizations. We have less mortality happening, some younger folks, shorter stays, but higher numbers. So it is a mixed bag. Red is when everything shuts down again, everything, to our strictest level. And so I do want to warn people that we're close to that. We saw some decent news last week of, like I said, that infection rate come down. Let's see where the projections are from the county for this week. And let's make decisions. We will always make them based on the data and on the science, and there's no question that we're close, but I also have no doubt in my mind that we can keep from going there if we each do our part right now. And the third one, there's a third question? I think that was the three. Okay. Did I miss anything else, Claudia? Okay. I'll go to the next question then. Thanks.
Next, we'll go to the line of Robert Kovacic with NBC. Please go ahead.
Hi, Robert.
Afternoon, Mayor. Happy Monday to you.
You too.
Mayor Garcetti, is there any data that shows the surge in cases has come from the indoor reopenings or any reopenings? And you warned us days ago that we could return to the mandated stay-at-home order. Yeah. Should Los Angelenos and people in the county of LA be prepared for that to happen?
So certainly we're seeing anecdotal evidence. Some of the, obviously, the biggest cases we've seen have been in work settings. You've well publicized and through the media, for instance, the LA apparel sites, and we've seen that in different workplaces, from factory settings to some office settings. We've seen them even in our own city family in some office settings as well. That's the first place. Second, it's tougher to say a location, but we definitely have heard from LA County that just folks who've kind of relaxed the prohibitions on social gatherings. Oftentimes this is done with people we know, so it doesn't feel like you're breaking the rules. The anecdote of the family that kind of had a smallish wedding and then didn't have really a reception, but 30 of them got together for a dinner afterwards in indoor spaces, and over half of them got infected. So it is some of those indoor spaces, certainly where you spend longer periods of time. Retail, which is a shorter amount of time, there's less evidence that that's any place with any big hotspot. So like I said, we've gotten smarter with being able to identify, but it's not a perfect science. I know a lot of people say, find exactly where the outbreaks are, just shut down those places, keep everything else open, full stop. It's a combination of what we do ourselves with our own actions, who we hang out with, which we shouldn't be doing outside of our households, and then in some cases, the spaces that are re-engineered. Some have been successful. Obviously outdoor dining, I think, has been a big success and not a place where we're seeing spread. We're not returning to closing down parks and open spaces because we've seen those aren't places of big spread, though please do wear your masks when you're on trails and when you're out there in our city parks. But that's kind of the mixed bag of things. We do anticipate, though, that as contact tracing continues, and I do want to thank our Department of Public Health, our contact tracing remains strong. The number of people is at the recommended, above the recommended national prescriptions per 10,000 people, so that we have enough people to call, but really implore everybody to answer those phones, to listen to those calls, and to tell them everybody you've come into contact with. We're not going to use that information for anything else. In fact, we don't do it at all. It's LA County Public Health. It's just to let those folks know so they can quarantine. And I do think it's important to remember those three things. Testing, which is critical, and we've surged up, as we know here in LA, to be one of the strongest regimes in the country. Not perfect, but one of the strongest. Second is then the contact tracing, and we need 100% compliance. Different points I've heard from the county that as many as 25% of people they're not able to get in contact with. I hope that we can move forward with both technologies that can help with that, and just even simple texting to let people know. We check in, what are your symptoms, and you tell a health worker how you're doing. And then third, it's quarantining. Don't forget to quarantine. If you've been in contact, don't say you take a test and you don't have to get quarantining. It's strict that we do that, and that's how we're going to bring those numbers down. So I do have a lot of confidence in our ability to do that. I just know we have to keep hearing that over and over and over, and we have to be vigilant. The last thing I'll say is the city has been involved in that enforcement. We go out, we've done literally thousands of visits to businesses. We are going to be doing more of that and coordinating that with the county. Sometimes it's their jurisdiction because they have a health license they can take away. Other times the city may have the ability to help shut down a business that doesn't comply, but our goal always is to get compliance. And we did see that more and more businesses were close to 100% compliant. It's just some of the spaces are tough to protect from. Thanks, Robert.
And do you anticipate the mandated stay-at-home order to return?
So we had a safer at home order. As I said, even then, not everything was always closed. But yes, if we go to red, that's what we will come. Today, I only know today. Ask me tomorrow. Ask me later this week. But I want everybody to take seriously that we're on the verge of that for sure. Thanks, Robert.
Gotcha. Thanks, Mike.
Next question, please.
Next question will go to the line of Joe Pollock with Breitbart News. Please go ahead.
Hey, Joel.
Hi, Mr. Mayor. Just a question about the policy on protests and gatherings. We've seen a variety of protests in recent weeks. Is the city taking a different position on protests with the new orders? No,
we are compliant with that, and that's important. The state said no indoor protests. They're too high risk, and anybody who is outdoors needs to wear a mask and needs to properly space. Okay. And I think I'm told that's the last question. Okay. Thank you, Joel. Thank you to all members of the media. Appreciate all of your questions. Thank you, everybody tuning in. And just try to capture that spirit that we had. I know so many of you have never let up, and the overwhelming majority of Angelinos have really shown their mettle, shown their ability to be resilient, shown their strength, and we need to do it again. Thank you, and we'll talk to you in the coming days as well. And I'm going to speak in Spanish and give the same message. Thank you, and have a good evening. Muy buenas tardes, Los Ángeles. Estamos en una emergencia. Tenemos que hacer lo que es necesario para eliminar este virus. Yo tengo mucho orgullo con las acciones de la gente de Los Ángeles en estos meses pasados. Pero es importante hoy a llevar una mascarilla, lavarnos las manos, mantener la distancia social y hacerse la prueba. No hay duda que se ha vuelto peor esta pandemia, no solo aquí en Los Ángeles, sino también en California y en muchas partes del país. No podemos ignorar estos hechos. Tenemos que aceptar los hechos y tomar acción para controlar este brote. La única manera de abrir la economía es gradualmente y tomar pasos atrás si el virus se empieza a propagar y pone en riesgo la capacidad de nuestros hospitales. Ahora tenemos que dar pasos atrás, cerrar los gimnasios, estudios de ejercicio, lugares de adoración, salones de belleza y barberos, junto con salones de uñas y salas de masajes y salón de tatuajes. Yo sé que estos cierres no son fáciles, pero lo tenemos que hacer ahora para salvar vidas. Cada vida es sagrada. Y además sabemos que el impacto económico es devastador para inquilinos y propietarios durante esta crisis. Y por eso hoy lanzamos el Fondo de Alivio de Emergencia para Inquilinos, el programa más amplio para asistencia de renta en el país. Asigna $103 millones para ayudar a inquilinos con $2,000 para cubrir la renta para los hogares con mayor dificultad, ofreciendo alivio económico también para inquilinos y propietarios. Las aplicaciones abrieron hoy. Recibimos un alto número de llamadas en este primer día. Entonces, por favor, no se preocupen. No estamos aceptando los que solicitan primero. Las aplicaciones permanecerán abiertas hasta el viernes a medianoche. Para aprender más y someter su aplicación, visita la página hcidla.lacity.org o llame a 844-944-1868. Estoy de acuerdo con las acciones del gobernador y gracias por su trabajo este día a proteger nuestro estado. Tenemos que trabajar con colaboración regional, estatal y nacional para controlar la propagación del virus. No hay fronteras entre estos espacios por el virus y nuestras políticas también deben reflejar esta realidad. Estos cambios están en efecto ahora en Los Ángeles y están diseñados para el brote en espacios interiores. Con los nuevos cierres vamos a aumentar el número de visitas a más negocios y hacer seguimiento con quejas en persona. Nuestro nivel de riesgo sigue en anaranjado, pero estamos moviendo muy cerca del nivel rojo. Debemos prevenir con nuestras acciones y pasos hoy. Las actividades al aire libre son más seguras, incluyendo comedores al aire libre. Pero si haces una actividad al aire libre, por favor, solo hazlo con miembros de tu hogar. Por favor, no se reúna con personas que no viven con usted. Es muy peligroso. Como padre, yo conozco la importancia de que nuestros hijos regresen a la escuela. Ellos son nuestro futuro y no queremos que se queden atrás. Las escuelas se abrirán de nuevo cuando sea seguro para nuestros estudiantes, nuestras familias y nuestras maestras y personales. Apoyo la decisión que tomó el distrito escolar hoy para empezar el semestre con aprendizaje en línea. Pero es mi esperanza con nuestras acciones que nosotros podemos tener un día donde nuestras escuelas están abiertas otra vez. muy rápida. Yo sé que esta decisión va a impactar a familias por todos Los Ángeles. Les aseguro que nuestro equipo está comprometido a colaborar con el distrito de LAUSD y nuestros aliados sin fines de lucro para asegurar que nuestros niños más vulnerables no sean afectados de manera desproporcionada. Los casos continúan incrementando. Hoy el condado nos informó de 2.593 nuevos casos. En total tenemos 136.129 casos. Este es un número más grande del total de casos en Canadá. Y en la ciudad de Los Ángeles, 964 casos nuevos están en la ciudad. A comparación, cuando aplanamos la curva en abril y mayo, el condado tenía un promedio de 875 casos al día en el condado. Y ahora estamos muy arriba de esos números. El número de muertes se mantiene estable, pero son tragedias. Y hoy el condado reportó 13 fallecidos, lo que nos lleva a un total de 3.822. Estos no son solamente números, son personas, son hermanos y hermanas, hijos, nuestras abuelas y abuelos. Es importante recordar que las muertes aumentaron por el aumento de casos. Y me quiero dirigir a los jóvenes hoy. Desde que esta pandemia empezó, el condado ha visto 56.888 casos entre personas de 18 y 40 años. Es el número más grande de infecciones de todos los grupos de edades. Y este sábado, 3 angelinos entre las edades de 18 y 40 fallecieron. Esta enfermedad te matará sin importar tu edad. Y si los jóvenes se contagian de COVID-19, además de poner en riesgo su salud, pueden contagiar a otros. Las hospitalizaciones siguen subiendo también y llegan a 2.103. Y en el condado hay 766 camas disponibles, incluyendo 625 de cuidados agudos y 141 camas de cuidados intensivos. Y hay 1.128 respiradores disponibles. Hace un mes teníamos 397 pacientes en cuidados intensivos. Hoy tenemos 565 pacientes en cuidados intensivos que están graves. Un aumento del 41% en el último mes. Si piensas que has sido expuesto al virus, pídele a tu médico una prueba de detección o ve a una farmacia CVS, centro de salud comunitario o un sitio de pruebas del estado, condado o la ciudad. En estos sitios de la prueba de la ciudad esta semana estamos ofreciendo más de 100,000 pruebas, un aumento de 25% de la semana pasada. Sabemos que no es fácil para todos ir en auto para hacerse una prueba, entonces estamos desplegando equipos de pruebas móviles a comunidades por toda la ciudad. Les recuerdo que damos prioridad de pruebas para personas con síntomas o quienes piensan que han sido expuestos al virus o quienes son trabajadores esenciales o trabajando en un ambiente de alto riesgo. Pero estas pruebas son fáciles y están por toda la gente sin síntomas y con síntomas. Para encontrar más de 100 sitios de prueba, visita nuestro sitio de internet coronavirus.lacity.org/testing o llámanos a 311 si no tiene acceso al internet. Y les recuerdo, no tengan una fiesta ni reunión. Estas no son las vacaciones del verano como siempre. Este virus no está tomando vacaciones ahora. y no lo debemos tratar así. Lleven una mascarilla, lávase las manos, mantengan la sana distancia. No es fácil, pero es necesario. Durante estos días estoy seguro de que lograremos esto juntos. Entonces, por favor, sean parte de la solución. Entonces, quédense protegidos, quédense en buena salud y quédense en casa. Mucha fuerza y amor. Gracias, angelinos. Hasta pronto. See you all soon. Thank you.